Do you think healthcare is a right or a privilege?
A right.
I think it's a right.
More of a privilege.
I think it's a right.
A right.
A privilege.
It's a right.
It's a right.
Healthcare is definitely a privilege.
It's a right, it's a necessity.
Do you have health insurance?
No, I don't.
Yes.
Yes.
Yes, I do.
Yes. I hope so.
I currently do not have health insurance.
Yes.
I do have health insurance.
But I got, a decent insurance provider through my mother's job.
I do.
I do not.
Well, I take that back. I'm over 65, so I've got Medicare.
What do you think of the coverage?
I really haven't used it, so I don't know.
It's good when you're young and healthy and you don't have any chronic disease in the nearest future.
It's good.
It's all right.
It could be better.
It's good.
I get pretty decent coverage and stuff.
It's terrible.
It's done pretty good for me so far.
You know, when you get to be 65, all you have to do is walk into the hospital. They take care of everything. It's just such a revelation to me when it happened. I couldn't believe it. This government, people are always complaining about it. When you're over 65, I don't care what you have wrong with you. You walk into the hospital with your Medicare card, it's done.
What do you think about universal single-payer healthcare?
Single-payer healthcare, meaning
It's a great idea.
I'm not sure what that is.
I don't know.
Never heard of it.
I don't know what that is.
I don't know what that is.
Explain to me what that is.
But is it close to like social medicine like in Canada? I think that may be a very good alternative to what we have.
I don't know what that is.
it is absolutely necessary.
I think it's a great idea.
I think that would be terrific.
So, well, I have experience as a provider, and it's extremely difficult to provide good care with current insurance.
Health insurance is provided, in the way I understand it, through private companies that, like, the relationship is that you pay them money and then they help, like, you when you're, like, they help pay for things. And then universal insurance would be something where, like, say the nation has a plan and is run through the government or something to provide healthcare for everyone involved. Whereas insurance companies, you have to pay into that system and buy into it. And so that immediately puts in that situation where you have to have money to buy into insurance. Whereas universal care, you would have it, period. My name is Heather Grant, and up until yesterday, I was a field organizer and canvasser for the Maine People's Alliance. Right now, 1 in 5 people in Maine doesn't have access to quality health care, which is 20% of our population, and it's really ridiculous. And people who are particularly affected by this right now are small business owners and their employees, and people who can't access healthcare through their employer, which is the main way that Mainers access healthcare. And the costs of healthcare are astronomical right now. To try to offset this, we have MaineCare, which is a system that provides care for those who can't pay for it, except that to be applicable for MaineCare, you have to make under $16,000 yearly income. And to give some perspective to what that number is, I'm a student at the community college locally, and I work part-time and I make minimum wage, but even I make more than $16,000 yearly income. So a lot of people are in this situation in Maine right now where they overqualify for MaineCare, but then they still can't afford to pay $700, which is what it can be for a family to have health care for the month. And so in that income gap, either they can't get access to care at all and they wind up using the ER a lot as a fallback provider, or even if you can't get that care, it doesn't mean you can take your kids to the doctor or have real access because you still have to pay copays and pay for medicine and all the other expenses that go with healthcare. And so what's happening with those who use the ER is there's a variety of problems with that, one of which being that it's not quality care, first of all. The ER isn't made, emergency room isn't made to be a primary care provider and to provide care for all the things that people need and wind up using it for. And then also people wind up putting off getting care until the last minute when it's really bad, when they don't have health care and when they wind up using the ER in that way. And so then their condition is worse and it's more expensive and it's physically worse for them and emotionally more traumatic. And then also, by using the ER as a primary care facility, it's costing a huge amount of money to do this, and it's really hurting our economy and costing people who are paying for healthcare more. And so it's really affecting everyone in this system right now that this is happening. And it's part of the reason I think that the premiums have gone up for healthcare and that it is so expensive. My friend from pharmacy school was telling me that in Germany they have private healthcare, but they don't have it through for-profit groups. All the insurance companies, while being private competitive companies, are run as nonprofits. And I think that would be a highly sustainable solution for America, where we could keep that ideal of having private competitive systems that you could pick and have that choice, but at the same time would it would still be run as a nonprofit, so there wouldn't be this overhead of money going into CEOs' pockets and everything like that. I'm really excited about the fact that Obama is so strongly supporting healthcare reform, but something that we've been talking about at Doors a lot and talking to people a lot about is that just because we've elected this man and he's going to be our president now and he supports this doesn't mean that we get to all just like watch it happen on TV, because that's what we tried to do in 1992 with Clinton, and Clinton was obviously a huge supporter of healthcare reform and he was really behind this, and then we didn't really see any results from it. That's because these insurance companies are making a huge profit off this system that's happening now, and so Anthem Healthcare made like $75 million last year just in main alone in profit, and so they're making this huge profit, and they pay for lawyers and lobbyists and all that to keep it the way it is. And so if we want to see a real change in this, we can't just wait for it to happen. We have to be active as citizens and really make space for that and be participants in this issue. And that's what the Maine People's Alliance really works to do, is to aid people in that effort and to make it so we can have our voices heard about this issue, and to really balance out the voices of the insurance companies, because this is something we need right now. I heard a good quote on the internet the other day about how when you vote for someone politically, that's like brushing your teeth in the morning. It's what you do before you go to work for the day. And so we still have a whole day's left of work to see this through and to like really have this happen, and we need it. Like, we need it so bad. And so yeah, it's just really important that people are actively engaged in the issues that are important to them, especially issues like this that relate to people's health and their quality of life, and that we continue to be engaged in this situation, have our voices heard legislatively, and call our senators and all that, and yeah, just be engaged citizens, because the work doesn't end here.